Hello again.
Hello, everyone. Welcome. We've had a little hitch. So our chair and John, one of our co-chairs, is struggling to get in. So myself and Ethan will start things off. And so I'm going to let Ethan introduce himself in the first instance, Ethan. Although,
Cool.
to be honest, we had a lovely little conversation earlier where we heard some of your background. So that was great.
Yeah. I'll just go over it again. So, yeah, my name's Ethan Thomas. I'm a 23-year-old who was unemployed for a really long time throughout the pandemic. And I've recently got into employment through the Kickstart scheme, working for Cardiff and Vale Health Board. So yeah, I'll be talking a bit later, going a bit more into my experiences of getting into employment, really. Yeah.
That's really great. And I'm standing in for Anne, but as you can see, I'm not Anne John. I'm Kieran Humphreys. I'm a consultant in public health with the wider determinants of health unit that run the Public Health Network Cymru, which is hosting this event. So I'm really pleased to have everyone here today. This is new technology for many of us. So don't be afraid to put things in the chat, ask for help if you need it. If you look around, there are people who are tech supports when you're at your table who can help you, or just ask for help in the chat. So the aim of this event is to share knowledge and galvanise action, to increase action to good, fair work, to improve health and health equity. And we're particularly focusing on young people coming out of the pandemic. So we'll have quite a lot of information in the morning about some of the experiences of people, the impact, and then the afternoon, hopefully there'll be an opportunity for everyone to get really involved in shaping what we may do next about these issues in our workshops. We've got over 200 people registered to join from as far away as Venice, academics, local health board, health sector, third sector, local government, Welsh government, private sector. So really, really broad spread of people. So I think this new facility, which allows us to chat and network, is a great platform for those people. And just when you get into, before this, everyone was allocated onto a table. You can move tables by clicking around. You can hover over people's names, see who they are if you want to chat to them. But when you're at the table, try and turn your camera on and your microphone on, because that'll give you a chance to have a chat with the people around you during the breaks. And then you'll get pulled unceremoniously back into this forum, even if you're in the middle of a conversation, when it comes to hear from the likes of us. So, Ethan, can I hand over to you to introduce our first talk?
Yeah, so we have a pre-recorded message from Chief Medical Officer for Wales, Dr. Frank Atherton, on the theme of supporting recovery and future priorities.
Well, good morning, everybody, and thank you very much for inviting me to attend today's conference on good work and good health. I'm absolutely delighted to be able to join you, albeit virtually. Of course, in an ideal world, we'd all be able to meet together, but these are strange times and we're not able to do that. But I'm particularly pleased on that note that this conference has decided to explore the employment impact of COVID-19 on the working lives, the health and the well-being of everybody in Wales, and that it has a particular focus on young people who have borne the brunt of much of the restrictions that we've had to put in place around coronavirus. So that's going to be a theme that I speak to. Just a note on the current kind of status of the pandemic. We're not out of the woods by any means yet. Things are opening up. And we hope that will continue. We've always tried during this pandemic to balance the direct harms that people have been experiencing in terms of hospitalizations, intensive care, unit admissions and deaths, with the broader societal harms that we know come from lockdown. And we know that the pandemic has created risks, fear, and the loss of life and livelihoods across all of our communities here in Wales and, of course, around the world. And the impacts have certainly served to highlight the fact that we have in Wales and globally existing health inequalities, and they've been exacerbated, made much deeper by the pandemic. And I'm very conscious that the biggest impacts have really fallen on the people who have been least able to bear them, people who've already been experiencing income inequalities or social and societal disadvantage. Now, I know that it's a difficult time in that the health and social care workforce in particular has been pushed pretty much to its limits in many ways. I get two stories when I talk to health professionals. I sometimes talk to intensive care physicians and nurses, and they really have been at the front line and face some very difficult times. They are exhausted, need to rest. I also talk to other clinicians, orthopedic surgeons, some other specialties, disciplines, where they're very frustrated because they've not been able to do the work that they have been trained and want to do to help people here in Wales. So it's not uniform, but by and large, we need to make sure that we take account of the fact that the workforce is really quite tired. And I also have to recognise that many people, and probably a lot of people on this conference, have actually moved roles. They've moved around and they've been very adaptive and responsive to the needs of society, building up new skills, hopefully, as they do so. If we look at reports from people in the health and social care workforce, many are feeling physically and mentally exhausted, have been subject to feelings of isolation, as many of us have, and some people we know have been close to breaking point. So as the pandemic continues, because we're not out of the woods yet, a key priority for everybody who requires it is to have support in their both their short and their longer term physical and mental well-being. Now, Welsh Government has not been blind to this. We've recognised the stress and the trauma that NHS staff and social care staff in Wales have faced, and we've invested over £1 million in the Health for Health Professionals service. That was back in April 2020. Now, that was a service that was already available to GPs, to general practices, and we expanded that to cover the wider workforce. It's a free service which is anybody can access. It's completely confidential and independent, and it aims to support people with those acute feelings that I described, such as feeling overwhelmed or distressed, people who have difficulties in managing various challenges that the pandemic has brought, and those who feel that they may be developing symptoms of anxiety or depression. And we also need to bear in mind that many people have increased the use of alcohol, so alcohol use disorder has increased, and we need to be conscious that some members of our communities and of our workforce are suffering the effects of PTSD, post-traumatic stress disorder. So the Health for Health Professionals service in Wales has now supported over 1,000 individuals across the NHS in Wales, and there's been I've been pleased to see an increasing diversity of the sort of people coming forwards and looking for that help and receiving that help since the service was expanded in 2020. There's a range of other things, plans and programmes which we've tried to bring together to adapt in terms of our response to the pandemic. So Together for Mental Health, of course, is the Welsh Government's 10-year cross-government strategy to improve mental health, and our priorities are set out in the Together for Mental Health Delivery Plan, which runs through to 2022. And we've tried to strengthen that to take account of the pandemic because of those higher levels of anxiety, the disproportionate impact on particular groups, and the wider socio-economic impacts that we've been seeing. We also have an in-work support service which provides rapid access to tailored occupational therapy, to physiotherapy, to psychological therapies, and that's designed to help people who are employed or self-employed to return to work and to manage health conditions in work, which may be mental health issues or musculoskeletal, the whole gamut of potential problems. So that service continues to work to provide in-service support in North Wales and Swansea Bay, and that will work through till 2022, the back end of 2022. Now, in response to COVID-19, that service is also supporting furloughed staff, recognising the needs of people in that position, and the support for businesses has been extended to Mid and West Wales as well. So we've geographically expanded it and expanded the range of services available, with about £250,000 of additional funding to provide extra counselling and therapeutic services. And that's helping to meet some of the needs of a further 500 people in South East Wales. The out of work peer mentoring service is designed to support those who are furthest away from the labour market, to help them to rebuild lives and get back into training, into education and into employment. Really so important. And it's focused on providing the long-term support that people need to recover from either mental health issues or from substance misuse problems. That works on the basis of peer mentors who have been providing increased levels of support, both to existing participants who were in the service, receiving the service pre-COVID, and to new people who've come in with levels of anxiety brought on because of financial difficulties, homelessness, loss of employment, etc. All of those things brought on and exacerbated by the pandemic. And two final things: the individual placement support. I Can Work project is an employment support service which is integrated with community mental health teams, and that's aimed at supporting people with severe and enduring mental health problems. The project's been issued with additional funding to let it go into a second phase. And the Time to Change Wales, of course, continues to encourage workplaces in Wales to sign up to the Employer Pledge. That's the pledge, which is a public declaration which demonstrates organisations' commitment to challenging mental health stigma and discrimination in the workplace. When we look at wellbeing research, it suggests that good organisational leadership and a supportive work culture are really important if we want to have a positive impact on the psychological well-being of staff before, during and after a crisis. And during this period of increased pressure and anxiety, it's essential that employers send very clear messages that staff well-being really matters. So we're going to continue to work with Public Health Wales through the Healthy Working Wales programme to support employers and to make sure that this resource is able to help them to ensure that they're able to provide practical help and support to employees. It's absolutely clear that the world of work has changed hugely for many of us, hence I'm doing this call on pre-recorded on a video. Many of us have had to move to much more flexible ways of working. There's been some positives in that, of course, including, the ability to work from home, less travel, less polluting of the environment. So there are some positive spin-offs. And I know that you're going to be discussing today employer attitudes to those changed working environments. And I think part of the challenge is to figure out what are the positives that we can retain and build on, and what are the things which have negative impacts on the workforce, on our colleagues, and which we need to move away from. We've got to identify the opportunities. We've got to utilise this opportunity to identify them so that we can support businesses to continue to thrive and grow and to recover after the pandemic. Now, of course, the virus is still very much with us. Transmission rates, I'm afraid, are rising again here in Wales. Fortunately, fewer people are going into hospital and suffering direct harm because of the success, I believe, of our vaccination programme. But part of the response has to be now to start thinking much more seriously about recovery. That's something we've been challenging all the health boards to do. And as we do that, Welsh Government absolutely understands the importance of supporting mental health and well-being of our health and care workforce through the recovery period. And at the heart of that, we have to really have a very strong focus on equity. We want to ensure that everybody has an equal opportunity to be healthy. And it's really important that we reinforce those links between individuals, between communities, and with society as we rebuild the broader economy and regain economic activity and economic well-being here in Wales. On that basis, Welsh Government has employed a network of disabled people's employment champions who we hope will provide advice, information and support to employers across Wales, and will be able to really speak up for disabled people about employment and employment issues, the issues that they face and that they're struggling with. Welsh Government is committed to continuing to try to improve the employment opportunities of disabled people and to making businesses as inclusive as possible. so that we create the conditions where all individuals can thrive in the communities where we live, work and play. The mantra here has to be that we cannot afford to leave anybody behind. We leave no one behind in Wales. I'm very, very conscious, as I said at the outset, that the pandemic has magnified and worsened many of the pre-existing health inequalities which we experienced here in Wales. It's very clear to me that there's a significant link between fair work, and good health. We need both to go hand in hand. And to do that, we have to have a positive culture which can improve both mental and physical health. And the workplace is the place to achieve that. It's a place where we can support major public health initiatives, things which we're starting to get moving again now. They've been a bit on pause during the pandemic. Work around obesity, our Healthy Weight, Healthy Wales programme. Work around smoking and reducing the negative impacts of tobacco. I mentioned alcohol before. So all of those issues, if we tackle those through a workplace and a work settings lens, we can start to drive down some of the inequalities that we've seen here in Wales. So Welsh Government is going to wait for the confirmation to see what comes out of this conference. And I look forward to, and my colleagues in Welsh Government look forward to working with you all on the potential solutions that we can bring into play to improve equity, to improve health, to improve well-being here in Wales. There are blue skies ahead. I'm actually quite optimistic at the moment. Things are difficult with rising cases of coronavirus in the community, but we have to remain positive and optimistic. I'd like to thank you all for your efforts that you're going to put in, I know, to the conference today. It's through your work and the tireless work of many of us that we will get through these challenging times and build back better. So thank you. Goodbye. I wish you well in your deliberations, and I hope you enjoy the rest of this conference. Thank you very much.
Great. Well, that was great to hear. I think the message of nobody left behind and addressing inequalities is key to what this conference is all about. We're going to have a slight switch around on the agenda, and I'm going to move straight into the young person's my story, and kick off by giving Ethan a chance to tell us a bit more about the experience, Ethan, that you've had during this time.
Yeah, sure. So yeah, I'll talk a little bit about how I ended up on my Kickstart scheme. So when the pandemic kicked off, I had recently graduated university. I'd done a degree in music. So the first few months after university, I was starting to get involved in freelance work as a musician. I was sort of planning for my main source of income to be performance work. I was getting hired to play piano for various pop artists, playing at weddings. I was offered to work on a cruise ship, but then obviously when the pandemic happened, gigs had to stop quite quickly. So it was difficult because that was planned to be my main source of income. So I ended up on universal credit and I moved back in with my parents. And I did try to continue with freelance work for a while, just working from my home studio. But I think, like so many of us, the social isolation side of it was quite difficult. And it was really difficult to get paid work as well. So I ended up in a position where I was looking for other part-time work to keep me going. And over the course of about a year, I applied for a huge amount of jobs, really, in all kinds of various sectors, various administration roles, retail, hotel jobs, barista jobs, cleaning, postal work, all kinds of things. But I was just finding it so difficult to get any interviews anywhere. I think a lot of young people in a similar position to me were just applying for so many jobs, but just couldn't seem to get their foot in the door anywhere. And for me as well, my CV was quite bare because the only experience I had really was in within the music industry. So I was worried that maybe certain employers wouldn't recognize that as the experience. So I was finding it really difficult to get any jobs, really. But then I found out about the Kickstart scheme through my job centre, and I managed to successfully apply for this position doing administration work with Cardiff and Vale Health Board, and it's been really good. The thing that I really liked in the application process was that I seemed to be judged based on my enthusiasm rather than just the experience that I had on my CV. Yeah, so I've been in the job for about 2 months now. It's been really good. I feel like I've been able to develop a lot of skills quite rapidly, and it's just been really nice having the opportunity to turn up to an office and having social interaction with colleagues, and just the regular commitment of having the job to turn up to, I think is so important for giving, I guess, my life a sense of structure, which has been, I think, so important for mental health and mental well-being. Yeah, sorry, I think the fire alarm is going off. I'm going to mute quickly. I think we're okay. There's just a test. Apparently, they do it every day. Yeah, so yeah, I'll wrap up. So basically, I think the skills that I've developed on my Kickstart scheme are going to be really useful in whatever job I end up doing. I am still planning to get back into freelance work at some point, but I think that just the opportunity to get involved in the Kickstart scheme is still going to give me a lot of workplace skills, which are going to be so useful in whatever I end up doing. So I think it's been really great for young people like me who are starting to feel like a bit of a lost cause throughout the pandemic and really getting worn down from being out of work for so long. I think it's a really, really great thing. Yeah, I'm really happy to be here today, and I'm looking forward to hearing the other speakers. Thank you.
Thanks so much, Ethan. And I think you've really helped us see what that experience is like for you, because I know that many people, particularly those in public sector and other sectors, will have had a lot of cushioning throughout this whole process in terms of the impact of their jobs and lives. So really appreciate what you've been through and your willingness to share that with us all today. Thank you. And I should also say thanks to Cardiff and Vale, because I know they've really engaged with the Kickstart scheme and have created over 200 vacancies through that scheme. And I think that's an amazing example of what the public sector can do. So we've got Rita Mwanza, who's also going to tell us her story. We have a video from Rita, so I'll ask for that to be put on now, please.
Hello, my name is Rita Mwanza. I'm 22 years old and I live in Newport, South Wales, and this is my story. When I first heard about COVID-19, I was sat in the living room with my boyfriend and his mother, and we were watching the news. I didn't really pay that much attention because the way it was described on the news, I felt that COVID-19 was really far away. It was just something else that was happening in another part of the world, and my life wouldn't really change. Naively, almost a year has passed, and COVID-19 has changed my life forever, and obviously the lives of everybody else. During the pandemic, I was working in a financial services call centre. I was helping people who'd fallen behind on their bills get up to date and provide affordable payment plans or payment breaks when it was most applicable. I was doing this job in order to save some money for a new job that I was due to start in the travel and tourism and entertainment industry. I was really excited to start this job because I just think it's really important to have a sense of enjoyment in the type of job that you're doing, because the majority of us spend more time at work than we do at home. I also wanted to spend my time in a completely different environment, and I also felt that it would be a great opportunity for me to work in an industry that is ever changing, and I would be able to find jobs in the future. Now, during this time, I felt quite isolated from my family and friends while I was working at home within the call centre. I have family abroad in Zambia, but also friends who are scattered all across the UK, and not knowing when I was able to see them was just something that really impacted my mental health. I was also hearing people discuss that they couldn't make ends meet. They didn't know where their next amount of money was coming from, and they felt that they didn't have any support from the government or anyone, especially those that were self-employed. This, on top of my mental health, led me to actually leave that position within the call centre. Now, I found that when I was looking for help within my job role and understanding what was next due to the restrictions, but I didn't really have much help. The travel industry was heavily impacted, as were many industries, but I didn't even think that the government provided any clarity or help for me. I saw that employers were still hiring jobs, and knowing that my job was now in limbo, I was responding to other employers. Unfortunately, most of them weren't able to respond to me, or they weren't able to give an answer about what could potentially happen in the future. When it came to friends of mine who were of a similar age who had just graduated or were looking for their next steps, they also really struggled. Some of my friends didn't like the idea that the way they would study would change, and a lot had jobs and opportunities that were cancelled. Currently, I am going to be working as a scheme support officer. I found this job while I was looking for jobs on Indeed. I wrote down what I wanted within a job and what I saw within my future, and then I started going from there. Unfortunately, I will not be looking for jobs within the travel and entertainment industry because I do just feel that it's quite heavily impacted now due to COVID-19, and that's why things have drastically changed for me. The job that I'll be doing involves working with people that have complex needs, such as drug and alcohol addictions. I'll be helping them with their tenancy management and teaching them life skills and helping them with qualifications so they can move on to be independent individuals that can also contribute positively to society. I wanted to do this job because I do also have the heart to help people. I also feel that within the scheme that I'll be working in, there's so many positions and abilities for me to be able to develop professionally within my career. I really find that it's important for a job to provide care and support to you, but also professional development in a secure working environment. You're not going to be able to want to work up in a company if the company is also not in a good financial position, and also if that industry is compromised. I think that it's important as young people to not just look at where we are now, but also to look forward in the future. Young people need to be willing to find opportunities as well and not just sit and wait for them. Be prepared to give managers feedback about your job and what could be improved. I also think it's important for young people to be part of the dialogue with the government and also take time to respond to surveys so that you can get what you want. And I think it's important for the government to reach us in different places, whether that be schools, colleges, through surveys, and even in the workplace, so that companies can also have government support. And lastly, I really think it's important that the government also look into supporting local businesses. Supporting local businesses is so important to me, especially after seeing so many struggle in the Newport area and eventually close down. I think an apprenticeship style scheme with local businesses developed by the government to upskill young people within the local area would be fantastic, and a great way for young people to look into different industries and know how businesses work, but also find out what they want to do and also be better individuals so that they're more confident going into the world of work. Thank you for listening and enjoy the rest of the conference.
Hi everyone, I do apologize. We are having a few technical glitches this morning, and that's one of the reasons we have ended up doing some of these are pre-recorded this morning, although both Frank and the Minister had hoped to be here in person. But as a safety net, we have the pre-records. And so because we're having this technical problem with Risa's story, we're going to move straight on to Vaughan Gethin, Minister for the Economy, who's going to talk to us about the Youth Guarantee in this next recording. Thank you.
Good morning. I'm pleased to have an opportunity to speak with you as part of today's conference. I welcome the range of subjects that you're going to explore around work, health, and the impact of the COVID-19 pandemic, especially on young people. As we know, the pandemic has caused significant disruption and affected the economy and the labour market at an unprecedented scale. Significant proportions of our young people already in the labour market have been hit hard as they work in the sectors that have been shut down and where staff have been furloughed. For ethnic minority groups, the impact has been even greater. There are opportunities, though, that offer that important first step on the career ladder for young people as they leave education or training, and those have been disrupted or significantly lessened. The First Minister recently set out our ambitions as a government to mobilise a national effort to deliver the new programme for government with an ethos of collaboration, equality and social justice. How we deliver a genuinely fairer, more prosperous and greener Wales. Part of that is our headline commitment to deliver a young person's guarantee, to give everyone under the age of 25 the offer of support into work, education, training or self-employment. The young person's guarantee is one of our key priorities to ensure that there is no lost generation as a result of the COVID-19 pandemic. This is about delivering hope for young people, for their future, but also the future of Wales. And here in Wales, we're fortunate to have a one-stop shop for careers and employability advice through our Working Wales service. Working Wales is delivered by Careers Wales and offers free, impartial, professional, employability and careers advice. And that advice is tailored to an individual's needs and circumstances. The service undertakes a needs-based assessment and refers individuals on to the appropriate support. Working Wales uses the latest labour market intelligence and insights into the jobs market and offers a route into employability support and programmes. That's why Working Wales will act as a gateway into our young person's guarantee, to help young people across Wales and to provide them with the advice and information they need to help them make the right decision for them. Last week, I made a statement in the Senedd outlining the initial steps that I'm taking to ensure that we develop a young person's guarantee that will deliver for all our young people right across Wales. As part of that statement, I've launched a call for action, inviting the third sector, the private sector, education and training sectors, and the Department for Work and Pensions to work with us to ensure that collaboratively we play our part in supporting young people across Wales. I want to ensure that we deliver the best possible offer to make a practical difference with and for our young people. To deliver a successful young person's guarantee, we need to ensure that young people know what support is available, that we reach those who need our help most, and that young people's needs are met through offering as many valuable opportunities as possible to assist that young person to enter and stay in the labour market. We cannot, though, do this alone. We need a coordinated effort to ensure that young people can flourish in a changed employment landscape. And I do offer my thanks to the many partners across Wales who are already supporting our young people. These partners enable our young people to grow and ultimately gain employment. Together, we can extend the support that is offered so that more of our young people are ready for work and can take up work. They'll need the right skills, the resilience and the experience that are fit for the jobs of both today and of course the jobs of tomorrow. But it is as important that they have access to opportunities to gain that first step on the employment ladder, to experience the world of work, to develop both transferable and job-related skills and workplace competencies. As part of the next steps of the Young Persons Guarantee, I intend that we will engage with employers, sector representative bodies, public sector organisations, local authorities, and most importantly of all, with young people themselves. I want to start a national conversation with young people to understand the barriers that they face as a result of the pandemic. I want to understand their ambition and vision for themselves and for the future of Wales. I do acknowledge that the employment landscape has changed. We're not sure yet how much that is temporary and how much is permanent. That change comes with risk, but it also offers opportunity. It offers opportunities to collaborate, to overcome some of the obstacles that we now face, obstacles that we knew we faced even before the pandemic. Whether a young person has been unable to find a job after leaving education, or has been furloughed or unemployed as a result of the pandemic, I want to ensure that there is support available for them through the Working Wales service. Many of the skills that we possess, we now recognise are transferable skills. To ensure that we are able to meet the needs of a changing employment landscape, it's important that we continue to adapt and develop our skills. So it's important that we pursue our own development and do not become complacent. Now, here in Wales, we already have a number of flagship employability and skills programmes that support young people's growth, including traineeships and apprenticeships. And our new programme for government commits us to delivering 125,000 apprenticeships within this term of government. These programmes will help to underpin the guarantee, and next year we will have a refreshed employability programme to support young people, Jobs Growth Wales Plus. Now, I recognise the current challenges that a number of employers are facing in filling vacancies and to keep some businesses afloat during this difficult time. Our employer campaign and package of support demonstrates that we really are in your corner, with recruitment and wage incentives and training support for existing employees. I've also commissioned Working Wales to deliver a new job matching pilot to improve the connections between young people seeking work and the local jobs that are available. I'll be calling for much greater support to fill vacancies in areas that have significant job creation potential, such as the green economy, health and care, and digital. We'll look to areas where the Welsh Government has and continues to make investment, and we'll be calling on these sectors and businesses to help us to create new jobs, new opportunities. Strengthening the dialogue and cooperation between the education and training sector, employers and public authorities is also critical, and we'll look to achieve that through strengthening our work around the regional skills partnerships. In closing, I want to recognise that our young people hold the key to Wales's future success. Their talent, skills and creativity are essential to ensuring our country's economic success, and I look forward to working with you to enable young people to achieve their potential. Many thanks for your time, and I look forward to working with you all in creating that future for all of us.
Well, it will be nice when we can get back to meeting in the same room and not relying on this technology. This is proving quite challenging, and thank you so much for your persistence with us. We are going to be moving on now to our live speakers, which I hope will not have the same issues as we've had with our video speakers. So really sorry for the challenges we've faced. We're going to introduce Ethan. Do you want to introduce the next?
Yeah, sure. We're going to hear from Stephen Bevan, Head of HR Research Development, Institute for Employment Studies, on the theme of why good work is good for health.
Morning, everyone. Hope you can hear me. And here are my slides. Brilliant. That's working seamlessly. Okay, so I'm going to talk to you about some of the work we've been doing at the Institute for Employment Studies about the relationship between job quality and health. And I'll look at it partly from a public health point of view, but also from an organisational point of view, and make some references where I can to the issues of facing young people in the labour market. The Institute for Employment Studies is a research charity that was founded in 1969, and we do contract research for government, employers, trade bodies, professional groups, and so on. We've got a major programme of work looking at the health of the working age population and the impact of job quality, particularly on that. We're currently hosting a Health Foundation research fellow who's looking at labour market outcomes and job quality among young people. We've been doing work on in-work progression for young people working in hospitality, retail and social care. And we're also leading the evaluation of a big IPS trial in both Sheffield City region and West Midlands Combined Authority. I'm going to be talking to you about why I think good work matters. As you can see from this slide, I think it's pretty clear from the evidence that there's a strong relationship between job quality, performance at work, productivity at work, people's commitment to their jobs, their engagement with their work, their motivation, their attendance, their retention and well-being. These are all things that where there's mutual benefit, I hope, between employees and employers. We also know from the public health and epidemiological research that work is a social determinant of health. But I think we need to qualify that by saying that good work is really what we ought to be aiming for. And I'll try and explain in a bit more detail about what I mean by good work. We know that job quality has a social gradient and is an important driver of good health outcomes for adults of working age. If we go to the next slide, I'll explain a little bit how we are able to come to that conclusion. Most of you, I hope, will have heard of the Whitehall 2 study that Sir Michael Marmot and others have been doing actually for many years now. It's a large study looking at over 10,000 civil servants, and data has been collected in different waves. And I suppose that the key thing that's been identified is that they found that health outcomes seem to be worse for employees in lower status jobs. There seems to be this gradient in health outcomes. So this graph shows mortality by grade. It shows that people in the lower grades, so in the support roles, seem to have higher levels of mortality than those in more senior jobs. And in fact, the data also shows there's a gradient in physical health conditions such as angina, some elements of heart disease, bronchitis, and so on, as well as there being a gradient in health risk behaviours. So obviously smoking, diet, exercise seems to be worse amongst people in lower graded jobs. You go to the next slide, we can interrogate this a little bit more. So what if you control for these lifestyle risks? What do you find? Is there something inherent about the work itself that might also explain some of the differences in the health outcomes? So in this graph, you can see there's a relationship here between self-reported job control, so how much control people feel they have in their jobs, and aspects of coronary heart disease. That people who are in jobs where they have high levels of control tend to have lower levels of heart disease. Now, the implication of this finding is that job quality and health can be linked, but that the strength of the link is not fixed, and that employers can enhance some aspects of health by making different choices about the control, autonomy, and discretion and decision latitude that they give to their employees. So whilst there's a societal level gradient in health, which is affected by a whole range of things about housing, other social conditions, in terms of the aspect of job quality, there are things that employers can do to enhance this and therefore enhance health. It also suggests that it's not just psychological well-being that can be improved by enhancing job quality, so people's attachment to their organisation, their morale and their motivation, but also their physical health. So what are the components of good work that we've identified through the research? Let's look at the next slide. There are a range of different factors, and I'll go through them very quickly. At the top, we've got secure employment, and I'll come back to that a bit later on when I talk about precarious work. Giving people varied and interesting work, giving people autonomy, control, ownership over what they do, discretion over the tasks they perform, and so on. Fairness at work is really important, and I'd included within this important elements of diversity and inclusion. And so sociologists have identified both procedural justice and distributive justice as being really important in this area as well. A balance between the effort you put into your work and the rewards, not just financial, that you feel you get out of it, that there's a sense of balance and fairness in that process. Opportunities for learning, development, using your skills, a voice at work, having important decisions being taken with at least some consultation, for example, and then strong working relationships and support. I think the concept of good work has also had some important consequences during the pandemic. We've been doing, jointly with colleagues at Southampton Business School, a project called Work After Lockdown, which has been monitoring job quality and health during lockdown for those who've been working from home. If we look at the next slide, you can see that we found that there's been a strong link between mental health, control at work, autonomy at work, commitment, engagement, and self-reported productivity. So this graph shows along the bottom the proportion of people reporting their levels of productivity, how much work they've got done per hour worked in the previous 2 weeks. And then on the left-hand side is the WHO 5, which is a measure of mental well-being. You press the next button, please. And you can see here that what this shows is that mental health scores for the most productive workers were twice as high as the least productive. So there's a really strong correlation between people's mental health, which is, in our survey at least, strongly associated with aspects of job quality and people's self-reported productivity. Now, this is especially important if employers are going to adjust and adapt the design of jobs to optimize job quality. So let's look at the next slide and start exploring this issue of job design. So all these things are within the control of employers. If they really want to improve performance, well-being, productivity, engagement, and so on, they need to think a bit more imaginatively, perhaps, about the design of jobs. So the way a job is designed can influence the following things: the efficiency levels that can be achieved in the job, the sense that the job makes to the job holder, whether a job is motivating and satisfying, whether the job links well with other related jobs in a team, because no job is an island, and whether the job is beneficial or harmful to people's physical and psychological well-being. So not only can thoughtful job design enhance each of these factors, for job holders who are established in their roles, it can also help new entrants or those with less work experience. And I'm thinking here particularly about young workers. Young workers need to have access to these aspects of work. These are not just to preserve older workers or people in more established positions. Next slide, please. And if we go down to the next level of detail, what is it about job design for good work that has an effect on motivation and well-being, and which then transmits into stronger psychological health and physical health? So the opportunity to use a variety of skills, for example, is an important aspect of a job. If you're just doing the same thing the whole time, you get no opportunity to test out your skills or test the boundaries of your role. That is less motivating and is an indicator of less job quality. Task identity is about seeing a job through from beginning to end. So you can see a clear outcome. You're involved right at the beginning and at the end of the whole task. And it has some sort of meaning for you, and you can see the impact that it has. Task significance is about having a clear view about the perceived impact of the work, not just on the organization you work for, but perhaps outside it. Autonomy is about having a sort of delegated autonomy to do things in a different way, or to change the order of the tasks or the frequency with which you do them, and so on, having some discretion over that. Decision latitude is giving people a bit more control over when they do things, in what order they do them, giving them a say in decisions about job quality and the quality of products or services that they're producing, giving them feedback in their jobs so that they can improve and reflect on what they're doing. And then obviously growth potential. I think at the moment, it's too often the case that we think that getting people the opportunity to get a job is an end in itself, and we forget sometimes that progression and growth within that job is also important for people's well-being as well as their motivation. So you can see how these aspects of a job could be vital to young people entering work or seeking to progress in work. And it raises some interesting questions about job quality as people make transitions in the labour market, particularly from unemployment into employment. And especially as the focus that we have, particularly at times like this when the labour market has been through a difficult time, that we perhaps naturally focus more on the quantity of jobs that might be available rather than their quality. And I would certainly urge us to think as much about quality of jobs as quantity as we emerge from the pandemic and we try to get to open up opportunities for people in the labour market. Let's go to the next slide. I'd like to show you some data from Australia. This is the HILDA survey, Household Income and Labour Dynamics in Australia survey. Of course, they called it HILDA, didn't they? Peter Butterworth, who's based at the Australian National University in Canberra, and colleagues did some work to look at job quality amongst those people in different stages of employment and unemployment as they move between those states in the labour market. And they measured psychosocial job quality in different job contexts. These are the measures they used, looking at job demands and complexity of jobs, how much control people had, feelings of job security, and the balance between efforts and rewards. If we go to the next slide, I'd like to just point out one of their core conclusions, because it does get to the bottom of this issue about particularly in a labour market crisis, is any job a good job? And what I would say is that, well, let's read this out. As hypothesized, we found that those respondents who were unemployed had significantly poorer mental health than those who were employed. No surprises so far. However, the mental health of those who were unemployed was comparable or more often superior to those in jobs of the poorest psychosocial quality. Now, this doesn't mean that people are better off being unemployed in all circumstances, but it does illustrate the importance of improving job quality in entry-level jobs and taking steps to improve job design and opportunities for in-work progression. This is really important. And there may be a quote that you missed on a previous slide that went through quite quickly, but it was a quote from Frederick Herzberg, one of the grandfathers of organizational psychology, who said, really simply, if you want people to do a good job, give them a good job to do. And that sounds trite, but actually all the evidence points to that being a really true and valid and important dimension of this whole debate. Just finally, I'd like to point to another study that we've done using data from the European Working Conditions Survey, which is conducted by the European Foundation in Dublin, where we looked at the relationship between different forms of precarious work compared with what you might call the standard employment model. So that's the SER there on the left-hand side. And we've got different models of employment with different characteristics, which look at things like job security, voice, access to learning and development, access to health and safety training, and so on, different aspects of job quality. And you can see that, at least for the four on the left, the right-hand portfolio one I'll explain in a second, as those models become more precarious and more unstable and less predictable, the scores on the WHO measure, the mental health measure, get worse. So a high score in this situation is worse. And so what this tells us is that whilst employers, particularly as they're dipping their toe tentatively back into the labour market and are reluctant to employ people immediately on permanent full-time contracts, because the level of demand for labour is still very unpredictable, we need to be careful that isn't sustained. It doesn't become embedded in the employment models that employers use, and that we try and maximise opportunities for young people, particularly to find work which has stability and all these other aspects of job quality. Because precarious work, particularly if it exists long term and people are stuck in a sort of negative spiral of precarious work, can have significant long-term damaging impact on their mental health. The reason that the portfolio group is slightly different is that's a very mixed group. There are some people doing portfolio work, freelancers, for example, who actually have quite high levels of control and autonomy, and actually they don't mind the fact that their work is relatively insecure because they have a portfolio of clients and a reputation that enables them to manage effectively in the labour market. But that's a particular group, and I think that's not a group that I'd expect to see many young people entering. So let's go to the last slide and my conclusions. I think the evidence is really clear, and there's lots of material on the IES website that supports all this. So please do visit. The next slide just gives you the web address, which I'll show you in a second. But there's a really strong relationship between good work and health and well-being at work. And this really should inform not just policy interventions, but the things that employers do to try and attract and retain, motivate, and indeed get good performance out of their workforce. We know now what drives that link. We just need to do more of it. I think that whilst these things in some ways, particularly some of the correlational data I showed you from the Whitehall study, seem to be very stubbornly fixed in the social gradient in health, I think employers have a lot of choice over what they do, particularly in terms of job design. And I think that's a really important thing that we try and encourage to exercise. We also know that good jobs have therapeutic benefits for people living with long-term health conditions. I was involved a few years ago in a study looking at people living with schizophrenia in the labour market, and there is pretty clear evidence that particularly if people have access to competitive work rather than necessarily volunteering, and perhaps we can go into that a bit later on, that good quality jobs in the competitive labour market can have positive therapeutic benefits for people living with severe and enduring mental illness, to the extent that they've used less healthcare resources. So it seems to me that what we need to look at is, as the UK labour market and the Welsh labour market recovers, we need to ensure that precarious work doesn't undermine our drive for full and fulfilling employment. We need to convince employers that job design and job quality have a more enduring impact on workforce health than fruit and Pilates, for example, which I really worry has tended to become a tokenistic approach to improving well-being at work, rather than looking at some of the fundamentals of the way that the work is organised and jobs is designed. So as I say, there are lots of free resources and research papers on these topics on the IES website. If you'd like to know more, I've had to be necessarily brief, of course, because of the short time frames that we have. But if you want to know more about our work, or you have any questions that you'd like to ask, please do feel free to get in touch and to look at our resources. Thank you very much indeed.
Cool. Thank you so much, Stephen.
That was great, and that was really insightful, and you covered such a breadth of territory there, Stephen, so relevant to what we're discussing today. We're going to, I'm going to be passing over my co-chairmanship to Anne John, who's a proper chair, shortly. So I'll be saying goodbye from this perspective. Thank you for tolerating my intrusion into this part of the chairing. And Ethan, I'll let you pass over.
Yeah, so we're going to go for a quick comfort break now until 10:50. So yeah, we'll join then. But just in the meantime, if people would like to turn their cameras and microphones on, they're very welcome to start a conversation around their table. So yeah, but we will join back properly at 10:50 for the next section.
Thank you.
Welcome back, everyone.
Hello.
Hello, Ethan.
Hello, Anne. Hi.
I abandoned you in the first section. I'm very sorry.
That's okay.
Had lots of technical issues. So welcome all back to the second session this morning. I'd like to introduce Christian Heathcock-Elliott, who's worked in the NHS for 19 years in public health intelligence and health improvement. He's going to be working with the team in Public Health Network Cymru, and is going to be talking about COVID-19 related employment changes and how they've affected young people. So over to you, Christian and Kieran. I know you've met Kieran.
Thank you. Today Kieran and I are going to be talking about the work that the Wider Determinants of Health Unit in Public Health Wales has undertaken over the last 8 months. Slide, please. Since early in the pandemic, concerns over education, training and employment opportunities for Generation Z, the Zoomer generation, aged up to 25, plus particularly those from our most disadvantaged or vulnerable groups, have featured heavily in the news. Many have suggested that without sufficient action, there is a risk of a lost generation. Next slide. Many reports in the published and grey literature have documented the disproportionate impact it had on young people. The figures in this slide are illustrative. 1 in 3 young people in employment in Wales prior to the pandemic worked in shutdown sectors, the highest proportion in any age group. And these sectors, as I'm sure most of you are aware, are retail and construction. After the initial lockdown, in July, 44% of eligible employments amongst 16 to 24-year-olds had taken up the Corona's Job Retention Scheme, and this was the highest proportion in any age grouping. With the COVID-19 control measures, many workplaces could not offer face-to-face training, which led to a peak of 7,770 apprenticeships in Wales being furloughed, although this figure is now much lower as activities are resuming. At the peak in July 2020, nearly 1 in 10 year-olds were claiming benefits, principally for the reason of being unemployed in Wales. In February 2020, prior to the pandemic, this figure was 4.6%. And although the situation has improved, in May 2021, the figure was still nearly 8%. Also, there have been a number of indirect impacts which are likely to affect young people's opportunities to acquire work. For example, across the UK, there has been a sizable backlog in driving tests, particularly in some rural areas where public transport infrastructure is poor, being able often a prerequisite to accessing work, particularly as jobs in sectors such as retail and hospitality cannot be carried out from home. Next slide, please. Our work has been concerned with COVID-19 related employment changes and their effects on the life chances of current and future generations, with a focus on what we've done to reduce the adverse impacts on health and health equity outcomes. Our work has involved 3 strands. Firstly, to describe what we already know and future impacts of COVID-19 related employment changes. Secondly, to gather insights on COVID-19 related employment changes for young people, considering their experiences, current interventions, and what would make a difference. And thirdly, to produce an evidence map of the international evidence of promising employment related interventions which impact on health and health equity outcomes. For this presentation, we will discuss the findings from the insight work and the development of the evidence map. The qualitative insight work was undertaken by Beaufort Research with the aim to gather insights on the impacts of the pandemic on young people and potential solutions in relation to training, employment opportunities, and access to good work, with specific consideration given to health and health equity outcomes. Insights were gathered from 3 groups: young people, third young people, and policy makers and influencers in Wales. In total, 33 young people from across Wales via 6 online focus groups were talked to. These young people ranged in circumstances and included those in labour market entrants, those who were unemployed, those on furlough, young people with dependents, and those in precarious work. An online workshop was also undertaken with 16 third sector organisations who work closely with young people, either supporting them into work or training or providing wellbeing support. Online interviews were undertaken with national, regional and local policymakers and policy influencers from a range of organisations including Welsh Government, Department of Work and Pension, Bevan Foundation and the Wales 2UC. Next slide, please. I'll now talk briefly about an overview of findings from young people's experience regarding employment and pathways to employment. Next slide, please. Corroborating other work and research, participants from the third sector organisations and policy influencers had stated that the pandemic had exacerbated existing challenges in relation to employment opportunities and the nature of work, particularly, as our previous presentation alluded to, in terms of precarious working conditions intensified, and that the belief that there was less commercial pressure to adopt fair work practices, particularly as there would be a larger candidate pool and more competition for jobs. Secondly, related to the challenge to secure good and fair work. And it was felt by some participants that some young people would settle for any kind of employment and that this had been exacerbated during it. Lastly, it was felt that there was potential for widening inequalities amongst young people, particularly those between our most advanced groups across Wales. However, the pandemic also presented new challenges, particularly in relation to the uncertainties in the labour market during the lockdowns. The policy influencers and decision makers and third sector organisation were particularly concerned about mental health and well-being and how this related to employment and uncertainties and disruption, including employment pathways, including vocational learning. A number of participants raised the issue of childcare issues and the disruption to access and support networks. Many of the young people interviewed stated there were challenges with their motivation linked to the lockdowns, and many felt they reported being bored, stressed, anxious, or lonely. Amongst third sector participants and policy influencers and makers, there was a concern that without intervention, there was a very real risk of long-term scarring effects, particularly those amongst the most socially disadvantaged groups. However, it's worth noting that there were some positive impacts commented on. For example, most of the young people who were spoken to in stable employment felt generally well supported by their employer. And secondly, for some young people, the changes to employment circumstances acted as a catalyst to follow their ambition and consider retraining. Many third sector organisations felt that there was an increasing interest in entrepreneurship among young people. And the quote on the right suggests that some young people had actually started doing online courses and actually trying their own businesses, small scale businesses. Next slide, please. I'll now give a brief overview on the findings in relation to current intervention effectiveness. One of the main findings which came out with the conversations with young people was that they were generally not aware of support in relation to work. It was not top of their mind. Most said that throughout the pandemic, they'd relied heavily on family or friends for emotional and sometimes financial support. Some commented that they were unclear where to seek support on work-related issues, whilst some participants who had engaged in support services did report mixed experiences. And the example on the right in a quotation from a female participant with a dependent child who also had a mental health condition, they had found it particularly stressful when they were on benefits and continual phone calls from the job centre to go for any type of job. Next slide, please. Overall, it was felt from the policymakers and influencers that the interventions were making some difference, but limitations during the pandemic. In particular, the policymakers and influencers felt interventions giving more disadvantaged young people work experience, apprenticeships and placements were effective policies. Overall, Kickstart was felt to be a success in giving young people receiving universal opportunity to work. But some policymakers and influencers felt that it did not reach the anticipated numbers of young people and that it was an overly bureaucratic scheme and time-consuming for organisations to set up a gateway and for those businesses making applications to join the scheme. Two existing interventions were mentioned by a number of policy influencers and decision makers. Communities for Work, which is a tailored service which aims to increase the employability of individuals who are not in employment, education and training and who face complex barriers to employment. And a similar scheme, Communities for Work Plus, involving local engagement officers who target hardly reached groups and encourage participation in the programme. Finally, and consistent with other research, a number of participants were concerned about, as the furloughs unwound, that this would be hiding a good deal of unemployment. Next slide, please. Interestingly, amongst the third sector organisations and policymakers and policy influencers, very few specific health and wellbeing focused interventions were raised. It was generally existed before the pandemic to support people with mental health and wellbeing were expected to continue essential via regional partnership boards. Participants also mentioned fair work, although one policymaker influencer mentioned that joined up working was thought to be benefiting the Kickstart programme in Wales, with trade union guidance linking with Department of Work and Pensions and work coaches. The approach was helping young people understand their employment rights. There was also little mention regarding interventions for young people with dependent children, although the Parents' Childcare Employment Initiative in Wales was cited by some policymakers and influencers, but was felt to be small in scale. At a local level, some third sector organisations stated that they were working particularly closely with individuals around mental health and well-being, but they had felt that the COVID-related restrictions and limited face-to-face contact were making it more challenging engaging with young people. Generally, it was felt beyond Wales that Scotland, Northern Ireland, Denmark and Quebec were highlighted as adopting approaches that had helped to support young people and should be explored by policymakers in Wales. For example, in Scotland, 2 initiatives were mentioned: developing the young workforce and skills development. However, overall, most policymakers and influencers felt that currently it was too early to be able to properly evaluate the current range of interventions young people to get into work and employment and training. I will now hand over to Kieran.
So we've heard already this morning how important good work is for good health. And we've also heard some of the impact that COVID has had on the ability of young people in particular to access good work. So we wanted to have a better understanding of what could be done about this. And we took 2 approaches. One is the map of promising interventions, looking at international evidence. And the second was to get those views and insights from those young people, third sector and decision makers that Christian has already been describing up to now. So looking at that first approach, this evidence map was undertaken by Alma Economics, and what they did was they looked at all the international literature that related to how we could improve health or health equity through action relation to labour market policies. It involved having 83 studies from OECD region areas, so all comparable in some ways to the type of economy we have. And the vast majority of these studies are associated with some sort of positive health outcome. Some of these studies did find some harmful effects or no effects. So what this map really provides is the ability to dig into the different types of interventions, who they might be useful for, what the types of outcomes are, and really get into the evidence underlying it. The map's available online, and I would encourage anyone who's an interest in these interventions to go and have a look and explore it. But overall, the map identified 6 broad categories of intervention to improve health and health equity related to employment. One is active labour market policies. So they're those policies that help get people into work and hopefully into good work. And that includes things like training, job creation, job search assistance. But also passive labour market policies came up as well. And that's really recognising that those who are unemployed, having an appropriate income helps mitigate some of the health impacts that unemployment has. There were also a range of COVID-specific interventions that were identified in the map. For example, studies have demonstrated benefits of the job retention scheme in the UK relating to well-being when compared with unemployment during the COVID period. And then a range of family support policies, as we've heard from Christian, childcare and balancing children and work can be really important in terms of the ability of families to access good fair work, but also provide the support they need for their children and their child's development. Income transfers includes moving income from those really to those at the kind of bottom level of the income scale to help support the basic necessities for life. And universal basic income was one of those. The Welsh Government has announced a pilot in that, and indeed Public Health Wales recently published a report describing the association of that with health. And then later category, but actually this is a broader category. This is about changes within the workplace to help workplaces to be good, fair workplaces, and examples include minimum wage. So many of these types of interventions have come up in the insights that we got back from talking to the young people, third sector, and decision makers and influencers. So I'm just going to go through some of the key findings of what those people told us could be done. Broadly, there were 4 themes. One is about specific support for young people. One is about making work good and fair. There were wider interventions that could be considered. And the last one is around ways of working. Next slide, please. Oh. Thank you. In terms of specific support for young people, these conversations happened before the new government, before Programme for Government, but in fact, all the different groups we talked to, the idea of some sort of guaranteed offer came up as being a value. So a guaranteed offer, for example, of job, work experience or apprenticeship. Education was really highlighted, particularly for those people who'd lost out on education time during COVID, and trying to make up for that education was seen as essential to help get young people to mitigate against the impact of COVID, and also focusing on transferable skills. The transition points coming out of school or out of university we're also seen as really important transition points between one type of environment and another. And that's where things like careers advice, coaching and mentoring start to become really important. Structured pathways for development were highlighted. And an interesting point here around carers funding. So you can see that the third sector organisation flagged up that if you're doing more than 21 hours of study a week, you can lose your carers allowance. And that's it puts young people puts anyone who's relying on those allowances in a very difficult position. And obviously the need to focus on those hardest hit did come out quite strongly. Some of the groups mentioned were those not in education, employment or training, those who are disengaged in late education, people from more disadvantaged communities, and also paying attention to people from particular ethnic minorities as well. Moving on then to the theme of good fair work. Some of the issues that came up were about improving the working conditions. Obviously, raising minimum wage came up as a key theme in that, but also things like controlling 0 hours contract or improving sick pay conditions. The opportunity through how funding is distributed, particularly through Welsh Government, to have a fair work requirement for all those receiving funding was highlighted. And young people in particular talked about the value of more certainty with their working hours. And that included issues around balancing childcare. And I think that reflects back to really Stephen's point earlier about the nature of some of these conditions on health in the long term. And also the need for low cost or free childcare. employers supporting health and particularly supporting the mental health needs of those either entering employment or during their work life were also highlighted. But there were some caveats around this. So some people did tell us that they felt that we have to do what's pragmatic and right for young person early on, and sometimes waiting for that good job may not be the best thing for that individual. On to wider interventions. Green jobs came up as a potential solution involving the opportunity to reskill, the opportunity to achieve government climate targets. But of course, we're also identified as not being the sole answer, as being a relatively small proportion of total jobs. Public sector was seen to have a particular role, so becoming youth-friendly employers and helping people from disadvantaged backgrounds get into public sector jobs was seen as of value. And then some of the wider infrastructure barriers that need to be addressed, particularly around public transport, affordable housing, and digital connectivity for those who are disadvantaged. So the fourth theme that came out was around how we work. And here there was a strong message about the voice of young people, contributing to research, co-producing solutions, and also interventions. The need to value what young people have to offer in particular. This research did focus on young people and not judge on the age. But also, I think a really valuable kind of pointer in this is about looking at what we have already. So expanding on existing interventions rather than trying to introduce new things from scratch. So really building on what we have. And related to this is the importance of partnership working. So strong collaboration between organizations, and also that's both in developing policy, but also, for example, business and local authority working together to improve opportunities. So those four themes of specific support for young people, good fair work, wider interventions and ways of working came out really quite strongly. But those ways of working really reminded me of the ways of working that I think we're all familiar with, which are from the future generations' ways of working, about involving people, collaborating, thinking long term, taking a preventative approach, and really integrating what we do. And I think this COVID crisis has had a massive impact on employment opportunities for young people, which has a potential to have an enormous impact on their future health and the future health of their families. So I really do hope that today, during the rest of the day and during the workshops, we will have the opportunity to live out these ways of working to give a better future for young people and through good work for Wales. Thank you very much.
Thank you, Kieran and Christian. Thank you. So we're also going to hear from Dr. Benjamin Gray, who is public health researcher with Public Health Wales, who is currently leading the COVID-19 employment and health in Wales study. So yeah, over to you, Ben.
Hello everyone, can you hear me? I hope so. Right, so yes, hi everyone, I'm Ben Gray. I work in Public Health Wales in the Research and Evaluation Division. I just want to go over with you today some of the key findings and future work that we've been doing as part of the COVID-19 Employment Health in Wales study here in Wales. So yeah, next slide please. Okay, so just a bit of a background. We spoke about it this morning, and some of the speakers talked about it, the importance of employment and health. So the relationships between good health and good employment are well established. Those in good health have those in good employment have good health, and those in bad employment have bad health. Health features in the Welsh Health Equity Status Report the 2 of the 5 essential conditions for prosperous health. That's the health and employment and working conditions, and the health and income security and social protection. What we did find with COVID was one of the things that really was impacted was health, was employment. And at the start of the pandemic, estimations were that globally there was between 5 and 25 million jobs that could be lost. And in the UK, up to 495 million jobs, the working hours equivalent to 495 million jobs were lost in the second quarter of 2020. And up to the 3 months into November 2020, Wales witnessed 16,000 redundancies. And that's the highest rate in this period since 2009. So the COVID pandemic had impacts at the start and is continuing having impacts now on employment. Cover the next slide, please. So what we set out to do, this was something that we set out to do February, March last year. So we set out to do COVID-19 employment and health in Wales study, and we wanted to determine 5 things. We wanted to look at the impact of COVID-19 on employment security right at the start, identify those groups most at risk of either employment or financial insecurity. We want to set and have a look at the underlying prevalence of precarious employment in Wales. We also want to look at the continued impact of economic, social and public health interventions on employment and health. And we also want to look at the public perceptions of fair and future work. For this talk, I'm going to mainly focus on the top 2, and then I'll touch upon numbers 3 and 4. So how we set about to do this, to look at those 2 first things, the impact of COVID-19 on employment security, and identify those groups. We set out in May, June of last year. We looked at doing a nationally representative household survey. Normally, in non-COVID times, this is something that we do door to door, send an invitation letter, and then book an appointment. But we had to do a different approach because of COVID. So we looked at a push to web approach. So this was via an invitation letter and a reminder to 20,000 households in Wales, and we asked them to participate in an online questionnaire. It was open to people that are 18 to 64 in paid employment or self-employment, but not in full-time education. So and then we looked at the changes in employment pre-pandemic. So we asked them what they were doing in February 2020, their jobs, and what they're doing now, which would be May, June in 2020. We asked some questions on health and well-being, and we also took things like income, sort of job characteristics, and their household makeup. In total, we got 1,382 adults to respond, which is a 6.9% response rate. And the analysis we performed was chi-squared and logistic regressions to look at the association between demographics, health statement, and employment outcomes. Next slide, please. So looking at the impact of COVID-19 on employment security and the groups most at risk of employment and or financial insecurity. Next slide. So overall, we found that in May and June, 90% of the people that was of the respondents were in the same job as they were in February 2020. 6% had changed their jobs, and 4% had unfortunately lost their jobs. In addition, for our respondents, 27% reported being placed on furlough. The UK furlough figures at the time, May, June, were between 22 and 31%, depending on what day or week you looked at. And in Wales, 316,500 workers in Wales had been furloughed. So even though we had a small response rate, our figures were broadly representative of what was going on in the UK and Wales. Next slide, please. So if we're going to look over it, we'll look at now the characteristics of those that respond. So if we look at age, the younger workers, we've heard about this in Kieran and Christian's slide previously, were hit hardest. Over one in three younger workers were placed on furlough, and they were 2.5 times more likely to have been placed on furlough than those in the 40 to 49 year age group. And again, we saw a U-shaped impact, which has also been reported by, amongst others, the Resolution Foundation. And then almost 1 in 3 workers were older workers, so those 60 to 64 were then placed on furlough they were two times more likely to have been placed on furlough than those in the 40 to 49-year-old age group, and they were also less likely to have changed jobs or secured a new job compared to this middle age group. Next slide, please. And then we looked at this by household characteristics. So here you see deprivation quintile. We've heard about this pandemic exacerbating and widening inequalities. Again, furlough, the most deprived communities had the highest proportion of furlough, and there was a small gradient effect then to the least deprived, from 31% to 18% of being placed on furlough. Another household characteristic that to consider is household income and being able to afford basics. So those that had reported financial insecurity and not being able to afford basics in their household were 2 times more likely to have been placed on furlough or had lost their jobs in May, June. Next slide, please. And this is one of the things that we added to our work that no one had. So our novel factor really is the impacts on self-reported health. So there we say that the impacts on those that have got a pre-existing condition, a higher proportion were placed on furlough. Those reporting low mental well-being, a higher proportion were placed on furlough. But sort of flip side to that, those that reported not good general health were less likely to have been placed on furlough. So not all bad health outcomes sort of translated into a higher proportion on furlough. And those that reported low mental well-being were also 4 times more likely to have reported experiencing unemployment in the early part of the pandemic. Next slide, please. And if we look at job characteristics, so we go back to looking at job quality and all the things that Stephen touched upon before, those employed on atypical and fixed term contracts. For this, when we talk about atypical contracts, it's about that precarious employment. So it's those that are on 0 hours, on those that working without a contract, or those that haven't got, and then when we looked at fixed term contracts, it's those of any length with fixed term contracts. So those are the ones that hit hardest, 11 and 4 times more likely to have experienced unemployment at the start of furlough compared to those holding those secure permanent contracts. And again, over half of those with those atypical contracts were on furlough at the start compared to lower numbers again of fixed term contracts or permanent contracts. And again, and looking at jobs, can you go back a slide, please? And those that have changed their jobs or less job security, those atypical and fixed term contracts, 3 and 2 times more likely to have changed their jobs or had to get new jobs. And we looked at skill level again. So those that in low skilled work, a higher proportion, for nearly again over 1 in 3 were on furlough compared to these high skilled workers. And again, these figures that we've got here are reflected in the UK and the Welsh statistics. Next slide, please. So that's what's going on. That's what we found that went on in the early stages of the pandemic. What else we wanted to set out to do was look at underlying prevalence of precarious employment in Wales. And to do this, next page. So this is a piece of work that's in progress at the moment. So precarious employment associated with poorer health. The prevalence of precarious employment is not widely reported in Wales. So what we wanted to do is we wanted to look at try and get that prevalence to just see where we were before. So in February 2020, before the pandemic. So as we think about leaving no one behind. And then we also wanted to understand which elements within the employment precarious scale, which is a scale developed by academics in Spain, are the key drivers to precarious employment in Wales. So precarious employment is not just about contract type and contract length. It's also about disempowerment. So that's about control over working conditions, pay. It's vulnerability. So it's how you feel you've been treated. Do you feel that you've been discriminated against? Wages. So how much are you paid? Can you afford basic expenses? Can you afford those unexpected expenses? And also the rights that you have. And to do this, we use the in-paid employment subsample of our survey respondents, which is about 1,200 when we took away the self-employed workers. Next slide, please. So this is, and on the scale is technically you can have You score, there's a series of questions for each of these domains or factors, and then you, depending on what score you get, you either no low precarity, a moderate precarity, or high, very high precarity. And as you can see, actually, when we look at temporariness, that's contract type. So 90% of people in Wales seem to have a good contract type. Sort of control was one of the highest reported precarity. People with nearly 30% of those saying they've got high or very high disempowerment. So that's that lack of sort of control over their work. And then wages, again, another one that was quite high, so reflective of in-work poverty, and then again, not so much rights. So that's the picture overall in Wales that we've got of those factors that are influencing the job quality in the job market in Wales in February 2020. Next slide, please. And even though there wasn't huge, over 1 in 4 of the jobs were actually calculated to be in precarious employment. And this was more prevalent in our younger age group, again, 18 to 30 year age group. Nearly half of those in that age group are in precarious employment, which is probably reflected why they suffered so much in the furlough scheme and the adverse impacts of job losses, etc., at the start, in the early stage of that pandemic. And females are more likely to report being in precarious employment, and those also with poorer health. And the associations with poorer health were observed more in those who reported high precarity in wages, so in work poverty, not being able to afford basic or unexpected expenses, and those vulnerabilities. So if they've got a pre-existing condition, they do feel that they're treated unfairly compared to their more healthier counterparts. Next slide, please. And this is another piece that's in progress again. This is looking at the wider sort of longer term impacts on the economic, social and public health interventions. Next slide. Yeah, so this is what I said. So out of those respondents that we had, we invited over 1,000 said that they'd be happy to take part in a second survey to be delivered later in the year. So in December 2020 to January 2021, we invited those individuals, and we had 626 responses, and so there was 58% response rate. And what we want to look at now is we want to understand the changes in employment and financial changes since pandemic. So how household income over those 3 time periods of February 2020, May, June, and December, January has differed. Also, in terms of employment, have we got differences in those that have been furloughed the whole way through, those that have dipped in and out on furlough? And we're again look at differences across demographic groups, again, the age, gender, deprivation, and the differences by health. And as part of that, we also want to look at the longer term impacts. So with the Centre for Population Health and Wellbeing Research and with SAIL Data Bank, we're looking at the differences by health, primary and secondary care usage through data linkage. Next slide, please. So in summary, the visible impact of employment changes, again, disproportionately impacted on vulnerable groups, so younger and older groups, those from more deprived areas, those in more precarious employment contract types, and those in poorer health. The coronavirus job retention scheme or furlough has been supportive, but as it comes to an end in September, is it though we've already seen the impacts on those disproportionate groups? Is it going to impact on those? Are they going to, they're more susceptible to job losses in the future. So bearing in mind that they could be people that we need to help out in the future. We need to understand the drivers of precarious employment to help inform action so that all the jobs that help in the recovery aren't or precarious and inflexible. And we need to look at the impacts that we want to understand the impact of the immediate and sustained changes to employment and health, as this is it's less well understood and it's a work in progress. And next slide, please. So just a few acknowledgements to end. I'd like this to acknowledge the study participants, because without them filling in the questionnaire and the survey, we wouldn't have the data to inform our recovery and to present to you today. I'd like to thank MER Research, who undertook our data collection process for us. The co-authors, Richard Kyle, Gelsong, and Professor Alicia Davis, and our wider study team that are helping with this, Kieran Humphries, Kate Isherwood, and Lois Griffiths. If you've got any questions, I think we've got a Q&A session following this. My email address is there. You can ask me a question on Twitter And if there weren't any further information,
I'm going to slightly interrupt.
That's all right. But I'm done anyway.
We're running over.
No worries. I'm all done.
Thanks so much for that.
That's
really interesting work. I'm going to move quickly on to Mary Ann McGibbon. Mary, I'm going to switch my camera on when there's a minute left so that we've got enough time for questions at the end. So Mary's a consultant in public health in Public Health Wales, and she's leading on PHW's healthy settings work, including Healthy Work in Wales. And I think she's going to bring the perspective of employers, which, you know, are important stakeholders in all these discussions. So over to you, Mary.
Thank you very much for the introduction. Thanks, Anne. So I'm delighted to be here today. I think this is such a valuable topic for an event. There's so much to say. I'd like to start just with a shout out really to the Public Health Network Cymru team for organising today's event, particularly in the brave new world of virtual conferences, where, you know, which poses all sorts of challenges. I think it's very brave of them, and I'm very grateful. Thank you. Right. I just wanted to today look at employer perspectives, because the Healthy Work in Wales programme, which I lead on for Public Health Wales, we work directly with employers. So we want to find out what they think, and where we can help inform what they do, what we can do to support them to implement health and wellbeing approaches in the workplace to you know, support the health and wellbeing of their employees. And I wanted to kind of, you know, focus on this in relation to obviously good work as the theme for today. I'm going to draw on some research that we've been doing, both in 2019, sort of prior to the pandemic, when we undertook in-depth interviews with 700 employers on employer attitudes to employee health and work. But more recently, actually, an online survey of around 470 employers that we undertook together with in-depth interviews with 34 employers on the impact of the pandemic on employee health and well-being. I'm also going to have a little look using the Good Work survey that the Chartered Institute of Personnel and Development undertake each year. And they do that with around 5,000 employees across different sectors and in different roles to get a feel for aspects of job quality. So I'm going to draw on a bit of their work as well, because I think the employee voice is also very important, and also highlight the CIPD's Good Work Index. Thanks. So just, you know, we've already heard a lot about the relationship between health and work and health, and that's why we're here. And I just wanted to start by saying that employers really are instrumental in supporting health and well-being of the working age population. They're a really important route for reaching employees, but also for creating healthy and safe workplaces. And really, with the pandemic, never has health and well-being been such a high priority for employers. And this provides us with a huge opportunity to build on going forward, I think. And I think that, you know, the health and work cycle that you've got in front of me, there are significant benefits to employers of looking after and promoting employee health and well-being. And we need to use this as a lever, so that impact on productivity, the things that are going to resonate with employers and help employers understand the value of focusing on the health and well-being of their workforce. So the Chartered Institute of Personnel and Development, they've developed, so CIPD, they've developed a Good Work Index. And I've just set out there the 7 core dimensions of good work that form part of this index. And form the basis of the annual survey that they do with 5,000 sort of employees to get a feel for what's the workforce looking like across the UK. Their 2021 results highlight persistent inequalities in job quality. And as Stephen said earlier in his presentation, it's really important that we consider, as we return from the pandemic, we think about economic recovery, that we consider job quality alongside job quantity, during any post-pandemic recovery phase. I think that's a really important take-home message for policymakers. So just looking at some of the employer research that we've done, and I will say those are employers. Our 2019 survey was 700 in-depth interviews, and that was with Welsh employers across all sorts of sectors and size of organisation. The data from that highlighted that actually the majority of employers do understand the value of and the importance of the health and well-being of their employees, and the importance of aspects such as feeling valued, job security, and levels of work, workload, work pressures. They understood that these things have a big effect on employee health and well-being. But what we found was that large organisations are more likely than organisations overall to understand that these aspects and things like work relationships, for example, affect health and well-being of employees to a great deal or to some extent. But I think our findings in 2019 sort of highlighted there is still a significant proportion of employers who are indicating that they are perhaps less convinced that these factors of job quality are important to health and well-being. So there's still quite a lot of work to do in that space. Thanks. So just taking a look at job security, we, for our 2021 survey, which we undertook between March and May this year, so pretty recently, we asked employers, to what extent does job security affect the health and well-being of your employees in general? And it showed that 96% of those employees that we surveyed felt that job security was important to health and well-being. And that was a sort of an increase from 88% in our 2019 survey. So I think that sort of probably reflects the year and a half that we've just had, and perhaps a greater awareness of how important some of these issues, such as job security, are for health and well-being. We also asked employers about what measures they'd taken or expect to take in response to the pandemic. And we sort of, listed a sort of a number of measures which we felt might sort of come out of, come as a result of the pandemic. And overall, around half have increased recruitment or expect to, while 45% have redeployed staff. 38% have either expect to already have increased wages. However, in contrast, 35%, so almost the same number, either have or expect to freeze or delay. Similarly, 23% have or expect, while a quarter have or expect to make redundancies. So sort of quite a contrast there with different employers doing different things. But generally, larger employers and those in the public sector and health sector were more likely to have increased recruitment, which I think is probably not surprising, while it's the smaller private sector organisations and those in sectors such as manufacturing who were more likely to freeze, delay wage rises, freeze recruitment or make redundancies. So the picture is mixed, as you'd expect, across different sizes and different sectors. I mean, as Ben highlighted just now, a key thing to note is that good work isn't evenly distributed across the workforce. I think that's a really key thing. Occupational group influences access to good work, and the graph you see in front of you is from the CIPD Good Work Index and survey that they've undertaken in 2021. So occupational group influences access to good work, and it's the higher managerial and professional roles who often have that higher job quality, which reflects, what Ben said earlier. This has been a consistent finding of the CIPD survey year on year. And this group is also more likely to be able to work remotely, work from home or other remote locations. And it's interesting because those working remotely score more highly in the CIPD research on several aspects of job quality, such as autonomy, workplace relationships, and flexible working arrangements. And it's those in the routine, semi-routine and lower supervisory technical roles who are most likely to be furloughed during the pandemic. And basically furloughed workers have particular concerns about job security. And according to the CIPD, the past year appears to have negatively influenced their voice. So their voice at work, their ability to influence things and be listened to. And also negatively influence their workplace relationships, which means organisations need to think really carefully about reintegrating furloughed staff back into the workforce and how they do that. Anne, did you want to say something? You're on mute.
I said I switched my camera on when there was a minute left.
Sorry, thought I was, you wanted to say something, right. We need to pay attention to the inequalities that already existed before the pandemic, as well as those new complexities which have been brought by the pandemic. And we need to really make sure that we avoid exacerbating the disparities between occupational groups that already exist. We asked employers about their perspectives on remote working, really, the challenges and the benefits. Our findings really echo what was set out in the Public Health Wales Health Impact Assessment that was done last year on remote working. And, you know, not surprisingly, challenges included jobs unsuitable, reduced mental well-being was highlighted there by more than half of the employers, ergonomic challenges, lower staff collaboration, cooperation, and difficulties with technology, ironically. And benefits, better work-life balance, more flexibility for caring responsibilities, and saving resources such as the cost of travel. And just a couple of quotes there from, you know, we've been doing some case studies with some of our Healthy Working Wales award holders and looking at impact of the pandemic and their response to the pandemic and how they've adapted so that we can share some of those lessons and learn the lessons going forward. So just a couple of quotes there from two of our Healthy Working Wales award holders in relation to remote working. Another key domain of good work is relationships at work. And I think we'd all agree that our relationships at work, positive, but also indeed negative impact on our health and well-being. And the CIPD Good Work Survey looked at the difference between those homeworking and those not homeworking in terms of how positive different sorts of relationships were. And they found there's a difference across all relationships, but a lower score for those not homeworking. So a higher score for those remote working, homeworking, in relation to line management relationships and feelings of psychological safety. And the CIPD believes that the highest scores for remote work are explained not by the homeworking itself, but by what I highlighted earlier, by the occupational differences. Those in professional managerial roles are more likely to be able to homework. In other words, those working from home are more likely to report better working relationships because of their occupational group rather than because they are working from home per se.
Mary?
Yes.
Because we're sort of running out of time and we won't have any time for questions. Have you got many more?
I've got a few more slides. I was going to talk about employee voice, but I'll skip that one. I'll just highlight, employers are very much understand the impact on productivity, which I think is a really key finding, and that's one that was consistent between our two surveys. We asked employers about mechanisms to support a healthy work environment, and we compared it to our 2019 survey and found that they had increased mechanisms across many of those domains that are listed there in response to the pandemic, potentially flexible working practices, but also health and well-being policies and advocate, that kind of thing. I think this one's important to highlight. Health health impacts of the pandemic, employer perspectives on that. They reported an increase across a number of physical health issues, amongst their employees, including musculoskeletal issues, but also things relating to healthy behaviours, so alcohol misuse, which the CMO highlighted earlier, but also weight gain. And then the mental health issues also highlighted as a big concern by employers, and their word cloud there just explaining some of the words that they were using to describe some of the reasons for that increase in mental health, poor mental health. So I'm almost finished, Anne. What should good work look like? As it says on the slide, be fairly rewarded, allow for work-life balance, provide opportunities to develop and a sense of fulfillment, offer a supportive environment and constructive relationships, and give employees a voice and choice so they can help shape their working lives, but also be physically and mentally healthy. That's really important. And in terms of what employers can do, improving job quality.
Mary, I'm really sorry. I am going to stop you there simply because we're only going to have 10 minutes for questions. Hopefully we can share slides. So I apologise for that.
It's okay.
You're on the panel. So one of the things that's come up is that, so I think Ethan's going to join as well, is that I haven't introduced myself. So I'm Anne John. I'm a professor of public health and psychiatry. And I also am an honorary consultant in Public Health Wales. So if all the panelists could join, that would be great. And I guess one of the reasons I was asked to chair this is that a lot of my work focuses on children and young people's mental health and suicide and self-harm prevention. And there are very strong links, very demonstrable links between unemployment and job insecurity and suicide rates. And we did a child death review twice in Wales over the last 10 years. And I've been a real advocate for the youth guarantee. So about ensuring that those young people at those transition points in their lives at 16, 18, leaving uni, are offered employment training or education going forward. So we're going to dive straight in. Now, a lot of people this morning, including Stephen and Kieran, mentioned universal basic income. And one of the questions was, what do you think the impact of that is going to have going forward? So if we go to Stephen and then Kieran.
My take on it is that I'm all for testing and piloting and evaluating things as a researcher, as you'd imagine. So I welcome the announcement from the Welsh Government on that. My reading of the evidence so far is a bit mixed. I think the Finnish example, which is one that's worth looking at, where they paid people nearly £500 a month for 2 years, improved lots of aspects of subjective well-being. I think the data was weaker on whether or not it helped people find employment. So that'd be one of the criteria that I'd be looking for. I suppose what I'd also do is just point out that when Sir Michael Marmot is asked this question, he points to the need for universal basic services, not just income.
Hi, Anne. We actually have an expert of this in our audience, but unfortunately we can't drag him up. Adam, who wrote a report on this in Public Health Wales, and he's put the link up online. I think, as Stephen says, a key issue is just that it's evaluated and it's implemented in such a way that we can learn from it, because it's been tried in a number of countries. And I think some of the experience has been that it needs some political commitment and political will to see it through to the point where you can really follow up those outcomes in the way we'd like to. And sometimes, for example, changes that occur in the political sphere can mean that we don't get the evidence that we really need to compile. But I think there is certainly some evidence of its potential, particularly for those living in poverty, where there is good evidence that income, particularly for children, does have a major impact on health outcomes. So I think it certainly has promise, and I'm really pleased to see that the effort is there to evaluate it, and it will all come down to its implementation and evaluation, I think.
I'm going to ask one more question from the audience and then hand over to Ethan. So lots of the work, including, you know, I noticed Stephen was presenting the Whitehall study. So I remember seeing those results about loss of controls in occupations and things, you know, back when I was doing my MPH eons ago. So one of the questions was, you know, are these impacts different pre-COVID? Has COVID made a difference, or are we seeing relationships that we saw, you know, in the 2008 recession? Stephen, Kieran, and then Christian.
Yeah, I think we've seen well, we've seen a sort of amplification of some of these issues during the pandemic, and obviously we know all too well the widening of some health inequalities, the disability employment gap. We've got now the lowest rate of part-time employment ever, which has affected women particularly. So we've seen some quite, you know, difficult schisms in the labour market, which we're still trying to get on top of and understand. And there's clearly some of those disadvantages are unequally distributed as well. We've seen some accelerations as well. I think we've seen an acceleration in giving people, some people at least, more flexibility and autonomy about where and when they work. And we're yet to see how that plays out. It's certainly clear that for people working from home, it's not all good news. The mental health and social isolation issues that we've heard about so far already today have been amplified, particularly for young people. But I think that you know, one of the concerns I have is that we're potentially at risk of making some of the same mistakes we made after the financial crash in 2008, and not taking our eye off the ball in terms of wage stagnation, job quality, and also investment in learning and development, which I think was in decline just before the pandemic. So we really need to up that if we want to increase opportunities for good quality work for particularly young people and marginalised groups.
Anything to add, Kieran?
I think there's some similarities and differences between, you know, what we're experiencing now and some previous recessions. One thing that I think is quite dramatic is the very sudden nature of lockdown compared to some other recessions, but also the kind of bounce back that happens, which is certainly quite different from the 2008 experience. But of course, we've yet to see how that plays out with variants and you know, what happens in the future. I think a similarity is that the poorest tend to get hit hardest, and kind of a key factor we saw from the last recession was the austerity policy, which meant that those, you know, with lowest income actually lost more income, and the support services were reduced. And we've seen, you know, in that period, life expectancy stagnating, and in fact dropping in the most deprived groups in recent analysis. So the kind of long effects of that decline and the kind of government response are still being felt, which put us in quite a challenging situation for this, where we are now. But one of the positives is that actually the response has been very different in terms of supporting those most vulnerable in a way that you know, maybe wasn't there before, and a lot will count on how that plays out in the next few months, I think.
Over to you.
Cool, thank you. Yeah, so we have a question for Marianne. So you mentioned that the Healthy Work in Wales programme links in directly with employers. Would this involve occupational health professionals also?
And thanks, Ethan. Yes, we work directly with employers through our Healthy Working Wales programme. So, and that's providing advice, support, but also working towards awards around, good practice, basically. But we also have a parallel stream of work, which is around improving sickness absence management across Wales. And we've created a new partnership, which unfortunately had to go into abeyance due to the pandemic, but will start up again, which includes everyone who's got an interest in that agenda, because we're really focused on preventing people from falling out of work due to ill health. And that includes occupational health at that table, as well as DWP, Department of Work and Pensions, primary care, as well as Welsh Government, other policymakers. So really, really valuable group for taking forward that area of work.
Just another question for you as well. So are there any observations on the effect of home working on innovation?
Yeah, that was definitely something that was highlighted, particularly by our case studies with employers. So sort of digging down a bit deeper into how they've responded to the pandemic, and the kind of adaptations that they've made, and the thinking on their feet, really. And all credit to many employers across Wales for just having to respond quickly. And innovation was certainly part of that, certainly in relation to not just the technology, but also how they managed staff health and well-being, how they stayed in touch with people, the kind of mechanisms they put in place to make people feel that they still belonged to a team, to a workplace, that people were checking in with them on a regular basis, but also some innovation really around an increase we saw in the number of established buddying up peer type schemes or health advocates within the workplace who would be a go-to person for employees struggling to talk to as a first port of call.
So we're going to close at midday, running slightly over, which I guess is partly due to our chairing skills. How optimistic do you all feel? So I'm asking for like a one-sentence answer from everyone that we're going to be able to make these changes in the current UK and/or Welsh political environment and economic environment. So I'm going to go to Ben, then Christian, Kieran, Marianne, and Stefan. So, yeah, you first, Ben.
You first, so put me in the hot seat. I think this pandemic has been a really good example of how everyone has come together to actually try and combat something that's there. So I think if that way of working is taken forward, then I think we've got the better chance to actually get this sorted now than maybe before. So it's just carry on. I'm not giving you a yes or no, but I'm just going to say this way of working is a good way of working, and I think we should carry on as a collective voice and involve everyone to try and get to the answers.
Right, we've got 60 seconds. Christian.
Yeah, observation. There appears to be quite a strong political will on this, and particularly connecting to climate change and the green agenda seems really, this is potentially going to accelerate that as well. So I could see, cautiously optimistic.
Kieran, thank you. Kieran.
Yeah, I mean, I do think I'm also cautiously optimistic, I have to say. The minister's talk linked to it as in the bar, do have a listen, because I think it does help demonstrate the political will that is there to try and address these issues in Wales. But there are going to be challenges, and the future of work is changing as well, and that will also have its impacts. So a lot to be done.
Marianne?
I think the pandemic's very much shone a light on inequalities, and I'm hoping that that will make a difference going forward. I am optimistic. We do have a strong policy environment in Wales to build on. So I think if we work in partnership, collaboration is the key to this.
And Stephen.
Yeah, I'm encouraged by the work that's going on in Wales. I think there's a lot for the rest of the UK to learn from the sort of multi-agency joined up approach that you're taking. I think it's really important that we also just get people to recognise, particularly in the healthcare system, that work is a clinical outcome. And we need to think about that in terms of what it means in terms of commissioning and referral and support.
Well, thank you all. It's now lunchtime, you'll be pleased to know. You come back at 1:45. And I'd just like to extend a huge thank you to Ethan, because this is the first conference that he has chaired, and his co-chair was unable to get into the conference. So absolutely well done.
Thank you. Thanks.
And see you all after the break.
Thank
See
you.
you. Bye.